Dozens of Indiana nursing homes could soon be cited as non-compliant with the federal government's vaccine mandate. Brock Turner has more on how the rule could impact Medicare and Medicaid funding if employees aren't vaccinated.
For Ken and Oma Buckner, getting vaccinated wasn't a complicated decision.
For one thing, I didn't want to get it, and I didn't want to give it to my family. And if I could do anything that might stop that from happening, the vaccinations were the choice. It's a really crazy virus, and it's been going on a long time.
The Buckners are in good company. They're residents at Sugar Grove Senior Living in Plainfield. Around 85% of Hoosiers residing in nursing homes are fully vaccinated. After experiencing the virus firsthand, they were even happier to receive their vaccines and booster shots.
I was sitting down at the cafeteria eating lunch, and the nurse came along and said, "We want to test you." I thought, well, okay. And so they did the test, and they said, "Sir, you are positive. We got to take you home, back to your room." And it sort of hit me, gee, I'm a dangerous person.
His wife, Oma, was impacted too.
I came back here, and the nurse came by and said, "You're not supposed to be in there playing bingo. You're supposed to be in isolation," because he was. So that's the only thing I really missed was playing bingo.
Ken never experienced symptoms, which he credits to his vaccine and booster effectiveness. His wife, Oma, never tested positive. That's an example they and other health experts point to for the efficacy of vaccines. However, not all nursing home staff members are on board. Just over 78% of staff are fully vaccinated. That means there are hundreds of workers who still need to be vaccinated or file an exemption in order for their employers to be compliant with federal rules.
Now it's mandatory across the board for basically every healthcare provider and supplier that provides services to Medicare and Medicaid residents.
Fines, which range in severity, start in May for states like Indiana that challenge the federal rule.
You'll still be cited as non-compliant if you're below 100% in March, but they'll withhold actual monetary enforcement until 90 days from the rule. We have buildings that are at 100% today. There are a handful of them, right? So they are working towards it. So I do believe that a lot of facilities will either be at that 100% compliance level and certainly be above 80% so that they can avoid financial penalty and continue to work towards that 100% goal that will end up being ultimately enforced in May.
Sugar Grove is an assisted living facility and not required to report its data to the federal government. The facility's parent company, Tuterra, said it supported vaccinations and is working with staff to ensure everyone was vaccinated. Erica Bowman is the administrator at Miller's Mary Manor in Hope. Her facility is required to report.
I personally was a little surprised that there was as much resistance.
85% of her staff were compliant as of February 22nd, but the rate of boosted staff is even lower, which is common across Indiana. Fewer than 1 in 3 staff are boosted, while 75% of residents are.
I think that there was a lot of confusion of Omicron not being a severe virus, right? And so you're vaccinated already and you're already protected. And so the booster with this less severe strain, maybe it's not as important. And, I think that information is unfortunate. That belief or choice is unfortunate.
Bowman says she sees less resistance to the booster in her facility, which is above the state's average, and partially blamed the timing of when staff received shots. Education and trust are key too, she says.
So having those relationships and having that trust where the staff knows that if they have questions, if they have concerns, they have someone that is there to support them and talk them through concerns and that kind of thing.
Cattell and public health experts agree building trust is an effective but arduous task. Ken Buckner generally agrees, but offered a slightly different approach.
Ask not what your country can do for you, but what you can do for your country. And this is one of those times, and so it's infringing on your benefits and infringing on your rights to get a shot. Big woo.
For Indiana News Desk, I'm Brock Turner.